Hello. Hello, Narayan sir. Can we start? So your voice is not coming.
Yeah, class duty room Narayan sir topic
Can you hear?
Yes.
Sir, please unmute your mic. Yeah. Now,
Yes.
okay, sir.
Now, okay, sir.
Okay.
A very good afternoon. Myself, Ms. Chanchal, on behalf of RAV team, I would like to welcome our respected dignitaries, respected GB member, respected Gurujan, and today's guest speaker. Respected Guru, CRAV Guru from Kerala, Dr. N. Narayan, Nambudri sir, and all the Shishya. I welcome all in today's 149th webinar in this Gyan Ganga weekly webinar series. Before starting the series, I would like to pay my sincere pranam and gratitude to our mentors. Respected Pradham Bhushan Vaidya, Devinder Trigunaji, President, Governing Body RAV, respected Dr. Kaustubh Upadhyay sir and Vaidya Manoj Nisari ji, Advisory Ayurveda, Ministry of Ayush. Respected Dr. Vandana Siroha ma'am, Director RAV, for their valuable direction, encouragement and support for this series. Today, as an expert, we have with us CRAV Guru from Sri Dhairyam Hospital and Research Center, Kothathukulam, Kerala, which is going to enlighten us on topic role of Mansik Bhavas in diagnosis and treatment of Netra Yogas. Or at the end of session, there will be a question answers round to resolve the doubt and queries of the participants. Before proceeding, we may start session with Ashwini Shuktam Pranam. For this, I invite Dr. Arpita, HR Program Manager, Ministry of Ayush. Welcome, ma'am.
Hari Om. Shri Gurubhyo Namaha. Hari Om. Dravāṇe gatadidartham jarethe kridhre eva vruksham nidhimantamacha brahmane eva vidatha buddhashara adute vahavyajanya apurutra pratarya anarathe eva वीराजे पायमा परमा सचेते मेने एव तन्वा आशुम्भमाने दम्पति वक्रतु विराजनेषु शृङ्गे एव न प्रथमागन्तमर्वाक् शफाविभजर्पुराणातरोभिः चक्रवाकेव प्रतिवस्तो ओरुस्रार्वाञ्चा आयातं रथ्ये एव शक्रा नावेव नः पारयतं युगेव न एव नवोपधीव प्रधीव श्वाने एव नो अरि ईशन्यातनूनां खृगलेव विस्रसः पातमस्मान् वाते एवाजुर्या नद्ये एव रीतिरक्षी इव चक्षुषाया आतमर्वाक् हस्ता आविव तन्दे शम्भविष्ठा पादे एव नो नयत् तम्बस्यो अच्छा ओष्ठा आविगमध्वास्ने वदन्तास्तना आविव पिप्यतं जीवसे एनः नासे एवनकृता आभूस्ने हस्ते एव शक्तिमभिसन्ददीनः क्षामे एव नः समजतं रजांसि इमागे ओ अश्विनायुष्मयन्तीः श्रोत्रेणेव स्वधितिं संशिशीतं नीतानि वामश्विना वर्धनानि ब्रह्म हस्तोमं वृत्समदासो अक्रन् तामिनराजुजुषणोपयातं बृहद्पदेम विदधे सुवीरा आह हरिः ॐ शवां देवावश्विना कुमारसाः देव्यः दीर्घायुरस्तु सुमकः तं युवं देवावश्विना कुमारं साः देव्यं दीर्घायुषं कृणोतना हरिः ॐ. Thank you.
Thank you, ma'am, for enchanting Ashwini Yuktam. I would like to share a brief introduction of today's guest speaker, Dr. N. Narayanan Nambudiri. He is presently serving as CRAV Guru, Chief Physician and Director at Sri Devyam Ayurveda Eye Hospital and Research Center, Kothatulam, Kerala. Sir is personable Ayurvedic ophthalmologist with 28 years of background in vision care arena and general medicine. He has presented various papers and was a resourceful person in various national and international forums. He has numerous peer-reviewed articles in national and international journals. Now I request Sir to please start the session. Sir, your PPT is visible. You can start the session, sir.
Okay. Namaste all. Om Sri Gurubhyo Namah. And respected President, Rashtriya Ayurveda Vidyapeeth Governing Body, Padma Bhushan Vaidya Devendra Trigunaji, Director RAV Dr. Vandana Shiroha, and other members of RAV, Gurus, and all the Sishyas. Today, different than earlier times, I am planning to present another topic, role of Manasika Bhavas in the diagnosis and the treatment of Netra Rogas. Eye health and mental health are interrelated aspects of human well-being that affect each other in various ways. While treating a case of eye diseases or even in other cases, it is very much significant that one should assess his mental status of the patient and which desha, which kala, all these factors detailedly we should assess, and then only it is possible to plan a treatment. Vision loss can have a significant impact on one's physiological and emotional state, leading to depression, anxiety, and social isolation. Conversely, mental health health disorders also affect the eye health and function, as some of the psychiatric conditions and medications can cause visual disturbances and impairments. Vision, eye, it is the mirror of soul. That is the saying. So if something happens to the eyes, the mental torture, mental anxiety, the depression, the stressful stage, it is not possible to explain in one words. It is the sufferer, he is the very good example for that one. Therefore, it is important to understand the role of mental health and ophthalmology and how to provide holistic care to patients with eye diseases. Ayurveda improves eye health and mental health by detoxifying the body by panchakarma, rejuvenating the retina and the optic nerves with the netra rasayanas, enhancing the blood circulation and the nerve conduction with the srodoshodhana, and the restoring the natural vision by Netra Prasadana. So these are all the treatment. The Panchakarma, it is the treatment procedures even using in the Manasika Vyadhis. So that purification and that detoxifying kind of attention, it is very well essential in many of the Netra Roga Chikitsas. Ayurveda also recognizes the role of mental health in ophthalmology as it considers involvement of manas in the pathogenesis of eye diseases. We have to consider one thing. The four factors, Atma, Manas, Indriyam, Artham, the combination of all these four, without which there won't be any perception. So in anywhere, some disturbances happens that lead to the vision impairment, or in other sensory neuronal, sensory functional impairment. The mind is connected to the eyes through the channels of prana, tejas, and ojas. How manas affects the netra roga? Ayurveda states that the mind can affect the eyes in two ways, causing mental stress by creating mental impressions. Mental stress can disturb the balance of the doshas and impair the Agni, leading to the accumulation of ama in the body and the eyes. This is the samprapti of netra rogas. And this mental stress also can weaken the ojas, which is responsible for maintaining health and immunity of the eyes. Many of the dietary factors also, it is very good example that disturbs our physical status as even the mental status also. Mental impressions are the images or memories that are stored in the mind due to one's experiences or perception or imaginations. Mental impressions can affect the eyes by creating desires, attachments, or aversions, which can lead to emotional disturbances such as anger, fear, greed, or jealousy. Next comes causative factors of netra rogas, and there are sharirika doshas as well as manasika doshas. Need not necessary to explain all those things. And sharirika dosha imbalancement lead to different vyadhis. Manasika dosha imbalancement lead to many manasika conditions. And the Trivida Roga Karanas are the Prajnaparada, Asatmendriyartha Samyoga, and Parinama. Prajna means in wisdom or intelligence, and Aparadha means offense. So there is, whenever there is some imbalancement happening in the Prajna, that leads to diseases. Actions generated by Prajnaparada aggravate the Tridoshas and stimulate the Rajas and the Tamo Gunas, allowing disease to become established. Vitiated thinking, that means the Tridi Smriti Vibramsham. It is happening whenever the three Vibramsham happens, and a person unable to differentiate between the good and the bad. The patient may be, the people may be knowing that one particular thing is not good, but the desire to take that not good things. The Viruttaharas, they may be knowing which is Viruttha, but even then with the taste and the appearance they used to take. That is an example of Divimsamsam. And the Dridivipramsam, unable to detach himself from wrongful deeds. Know that this is not good, but even then doing. And due to Smriti Vibramsam, person unable to recall the mistakes he has done in past so as to avoid them in future. Asatmendriyartha Samyoga. This is one of the main reason for nowadays the eye diseases happening. Mental stress can result in excessive or improper use of the senses. Watching TV, reading, working on computers for long hours, or exposure to bright light, dim light, flickering light. This Asatmendriyartha Samyoga happened during the last pandemic period. Many were inside the rooms, not going outside. They are seeing only the walls. They are seeing only the TVs. only the near objects. They are not getting a chance to see the far away things. That later on developed the vision disturbances, can't able to see the far away things. The people becoming myopic or hypermetropic, and inside a lot of dryness happened. Later on, that developed some dryness in the eyes and astigmatism kind of development also noted in the last 2-3 years. That is more happened in this period, but it is normally happening asatmendriyartha samyogam. Parinamam, since seasonality is present in many aspects of human physiology, functioning, and behavior. Mental health and eye health is also affected by change of seasons. Time plays an important role in the pathogenesis of diseases. Diseases progresses in body according to the time, and the treatment in that certain time interval has value only, otherwise it will lead to complications and eventually death. Manasika bhavas. Charaka has given brief explanation of Manasika bhavas in Vimanasthala, which are 22 in number, and they are emotional factors exhibited by the patient due to various external stimuli. And the Manasika bhavas are there. There are some positive bhavas and negative bhavas. Positive bhavas are Mano Artha, Vijnana, Harsha, Preeti, Dhairya, Virya. These are all the positive bhavas, and Raja, Moha, Krodha, Shoka, Bhaya, Dvesha, Ubadi, etc. are the negative Manasika bhavas. And the positive things are good thing, and the negative things that leads to main some ailments, the Mano Vikaras. Rogaha sarve vijayade bego dhirana dharanan. Mental health factors like stress, anxiety, etc. also play a role in suppressing or forcing Vegas. The Vegas like, Dharaniya Vegas and Adharaniya Vegas. Adharaniya Vegas are just not supposed to suppress. Suppressing of such Adharaniya Vegas leads to ailments, and Dharaniya Vegas that one to suppress. If it is not suppressing, that also leads to Mano Vaikalyas. And this Mano Vaikalyas in later going to become different kind of rogas, Chakshuroga, Srotra Roga, many other conditions. And the Adharaniya Vegas like Vada, Sakrit, Mutra, Shava, Prit, Nitra, Kasa, etc. And this suppression of Vegas, this Adhovada Rodha leads to Drishtivata. The Vayu, Apana Vayu Vaigunya, that leads to many of the eye diseases. Sometimes eye dryness and intraocular pressure rising reason. Suppression of Sakrit Vega in a diabetic patient, in a proliferative diabetic retinopathy patient, whenever the Sakrit Vega of Vega Varodha leads to the vision disturbance, and there may be chances of vitreous hemorrhages, or sometimes retinal detachment getting chances are there. Mutra Vega, that also leads to Drishtivadha. Suppression of Chava, Indriya, Daurbalya, weakness of senses. Suppression of Nidra Vega, that gives heaviness of the head and the eyes. And suppression of the Bashpa Vega, that leads to Akshirogas. Dharaniya Vegas Dharaniya are those which are to be avoided or suppressible urges. Greedings, Lobha, that is greedings, Shokam, grief, Bhayam, fear, Krodham, anger, Nirlachada, shamelessness, Irshya, envy, Abhyasuya, jealousy, Madam, Chittotvegam, Vishadam. These are all the urges one should control. As you know, the Netra Roga Nidana mentioned in Susruta, Ushnabhidaptasya Jalapravesha, Dureshanath, Swapna Vivaryasha. In these red marked areas, these are all some of the Manasika manas involved nidanas. So whenever this Swapna Vipariyam or Prasakta Samrodhanam or Kopam, Shokam, Klesham, Atimaithunam, Bashpagraham, these are all the conditions apart from the other reasons. So these Mano involved bhavas also plays a major role in the development of many of the eye diseases. Swapna Vipariyascha. Change in sleeping habits, day sleeping, remain awake in the night. It is a clear example nowadays. The IT professionals and exam periods and their sleep pattern entirely disturbing. That leads to uh, eye strainers, eye pain, and temporal pain, occipital pain, body heaviness, head heaviness. Even that kind of stress and things leads to different indigestive issues also. IBS also may develop. Too much of gastritis developing chances are there. And working, especially the example, working in night shifts, watchman, nightclub parties, late night studies, all these things are example. And the dosha involved here is tridosha, more of vada and kapha. Diseases like if it is like that, if the eyes becoming dry, the diseases like kumbhika, periorbital puffiness, too much of strain leads to nystagmus of the eyes, too much of dryness lead to small inflammatory changes in the meibomian ducts, sometimes too much of netra, srava, hyperemia. These are all getting chances are there. Poor sleep disorders, sleep, eye disorders. During the past decade, association between sleep disorders and certain ophthalmologic disorders have been increasingly recognized. Study published online November 1, 2022 by PMJ Open suggests that poor sleep is also linked to high risk of developing glaucoma, a leading cause of blindness. People who had unhealthy sleep patterns, those who snored, experienced daytime sleepiness, had insomnia, slept less than 7 hours per night, those slept more than 9 hours per night were more likely to develop glaucoma than the people who had healthy sleep patterns. People had insomnia or sleep too much or too little had a high risk of glaucoma. Obstructive sleep apnea is associated with a number of serious systemic diseases and also several eye disorders, including floppy eyelids syndrome, optic neuropathy, glaucoma, AION, and papilledema, and sometimes secondary to increased intracranial pressure. Next comes Prasakta Samrodhana, that also one among the Nidana of Netra Rogas. Continuous weeping. The continuous weeping that leads to washing away the entire tear from the eyes and irritation, rubbing on the eyes. The required nutrients are lacking in the eyes. Hence, the bacteriostatic activity of the conjunctival sac and the lacrimal apparatus loses the stamina against the diseases. If the required quantity of the tear, if it is there in the eyes, that is the one thing which healthifies the eyes and that maintains good vision and that helps us to maintain the good pressure, the normal pressure within the eyes. And dosha vitiated here it is vata. And the diseases like cirrhosis, diseases of the lacrimal apparatus like dacrocystitis, sometimes meibomianitis, conditions like chalazion cyst, achaga, many things. Next comes kopam, shokam. Kopam, shokam, both it is a reason. Too much kopa. That leads to the pressure in, sometimes that leads to increase of the pressure inside the eyes. Eyes may become red in color. Lot of pain in the eyes leads to increase of intraocular pressure. Occipital pain, getting chances are there. And during anger, pitta dosha gets aggravated, and in grief, in shoga, grief, sorrow or depression, vata gets aggravated more. Diseases like blurriness, conditions like blurriness, subconjunctival hemorrhage sometimes, and pitta, vataja, vikaras. Klesha, stress also it is one among the main factor in the developing many of the eye diseases, especially the inflammatory conditions on the eyes and the fluid collections in the eyes. The CSR kind of changes, that is central serous retinopathy, either in the center or little away from the center. So many cases, PED conditions, all these things, the klesha could be one among the main reason. The medicines required to control these things, than medicines, some good psychological approach also needed. So here also the Raja and the Tama involvement is there. Adimayudunath. Excessive indulgence in sex results in Radhushaya and sex workers, excessive masturbating persons, sex addicts with the different partners. Dosha vitiated here is Vada and diseases like HIV, retinopathy. It is very serious thing, HIV, retinopathy kind of things and all. It is not even curable, and the eyes, it is too much of inflammatory changes. Later on, eyes shrinking, total vision loss happening. There are many infective eye diseases, and many of the people not noticing and what exactly happened, whether some infective changes happened in the inside or not, that also not checking, just treating for some just for inflammation, and the causes and the reason behind it no one is not clearly noticing. So that also very much essential to for the treatment and the management of such conditions in the early stages. For this kind of a problems, early conjunctivitis, retinitis, keratitis, early management that works good. The later period management, it is very risky, and the regaining chances are also very less. Dhatu, Shaya, Janya Vada Vikaras occurs. Bashpagraham, suppression of the tear in sorrow or grief. Suppression of tear leads to Ashtuja Davarta, in which dosha gets obstructed in Asruvaha Srodas. Dosha vitiated and a kapha due to the kapha dosha involvement is there, and vada become pangu and thereby getting pain, lot of irritation in the eyes, and the lid muscles become contracting, and that pressure effect it is happening on the eyes, that leads to pain on the eyes, and that pain leads to the head pain, even inflammatory conditions of the optic nerve, retrobulbar neuritis, and even many other serious issues may develop. So it is started in a small level, and its impact in future it is more. So all the things, the minimum, the small kind of early presentation also, it is one thing lead to become a bigger thing in future if unattended. What can stress do to your eyes? Elevated cortisol level, being constantly stressed or can cause cortisol level to become dangerously high, and it can reduce blood flow from the eye to the brain, potentially leading to the vision problems. Too much cortisol in your body can result in stress-related macular degeneration. And adrenaline also, increased adrenaline level is called as adrenaline is otherwise fight or flight hormone that causes pupils to dilate to allow more light to the eyes so they can easily catch possible, it can catch easy possible threats on the macular area. If you are constantly under severe stress, your body creates more adrenaline, causing prolonged pupillary dilatation, which can lead to light sensitivity more. That damages the macular area. The cells in the macula degenerating, and sometimes the color identification ability losing, and acute photosensitivity, too much watering, and pain in the eyes. As a result, you might develop eye twitching and tightened eye muscles. Increased risk of inflammation also there. Constantly increased stress levels can be associated with the inflammation. Also increases other conditions like lupus, psoriasis, rheumatoid arthritis, and Crohn's disease. Here, the manasika katakas leads to the eye disorders, and eye disorders may affect mental health also. Vision is one of the most important sense that enables us to perceive the world, communicate with others, and perform daily activities. Vision loss, whether partial or complete, can affect one's quality of life, social interactions, and emotional well-being. Studies shown that individuals with vision loss are at a greater risk of experiencing this risk depression than those with a normal vision. As I told you earlier, eye is the mirror of mind, the soul. For example, study by Ravner et al. Found that 33% of patients with age-related macular degeneration had clinically significant depressive symptoms. It happens because once vision loss happens, there may be some depression because up to 60 years of age, up to 70 years of he was seeing good, he was working, and that was the time to take some rest and that time enjoyment and relaxing. So the relaxation supposed to take relaxation time got affected kind of this problem that leads to more of depressive condition. Another study by Shaw et al. Found that 11.3 of the adults with a visual impairment had major depressive disorders compared to 4.8 of those without visual impairment. Poor vision can have an impact on your mental health. Depression, vision loss can double the risk of struggling with the depression. Anxiety, vision loss can increase the risk of anxiety, loneliness, and unintentional injuries. And social withdrawal, they can make one less likely to want to leave or your house due to feeling of anxiety, depression, embarrassment, and inadequacy. Study conducted in China to evaluate the sleep and the mood status in patients with the dry eye diseases and analyze the action of between sleep quality, mood status, and ocular surface characteristics. Patients with the dry eye diseases demonstrate higher respective depression and anxiety scores. A significant correlation has found between sleep quality and mood status in patients with the dry eye diseases. Shorter tear film breakup test and lower shimmer test results were associated with the poor sleep quality. More severe symptoms of dry eye were significantly associated with a higher level of anxiety in patients with the dry eye diseases. Mental health and refractive errors. Acute psychosocial stress induces a myopic shift in undergraduate students. Study conducted in Australia. Environmental influences play a notable role in the development of most prevalent refractive error, myopia. Recent past environmental status, especially those who are staying in the Dubai, Northeast countries, they are living in a small room, not getting the chance to go outside. That environment plays a risk factor of developing myopia, hypermetropia, etc. Dhumara. Acharya Vakpada mentioned the involvement of Shoga as one of the Nidana for Dhumara. Shoga, Jora, Siroraga increases the Tridosha and result in patients seeing objects very smoky. And this Shoga, Jora, Siroraga, these are all the sometimes the reason for the conditions like inflammatory changes on the macula. Not all the things. So if one also if involved there, that is sufficient to get the problems. So management should be focused on both the netra and manas. While treating here, ultimately I am ending while treating a netra rogas or any of the netra rogas, if it is relevant, one should attend that aspect also. If the reason behind, if it is possible to trace it out, that find it out, treat accordingly. If the reason it is soga, if the reason it is klesha, if the reason it is bashpagraha, if the reason it is kalam, if the reason that it means season, anything, find out the reasons and the mental stress generated from the home or from the other groups. Find out all these things accordingly. Also, the suggestions one can give to the patients. The drugs like Medirasayanas, like Manduga Parni, Estimadu, Shankarpushpi, Uduchi, Vacha, many of the Medirasayanas, which are all very well used in context of many of the eye disorders also. So Chakshushya Rasayanas and Medhya Rasayanas together combination, it works very good in many of the eye ailments, in the glaucoma conditions, in the retinopathy conditions, in a CSR condition, in the genetic disorder condition, in all the conditions together, was only Triphala giving not going to help at all. But Brahmi, it is a as a counterpart of Triphala. Brahmi along with the Triphala, it is a good supplement for the in many of the genetically generated eye disorders. Brahmi, it is good. Sangapushpi, it is good. Eshtimadhu and even though the main aim to control the next comes glaucoma, our main aim to control the intraocular pressure and thereby preventing further field loss of field vision loss. So what is the reason behind the glaucoma? Find it out. Treat for that one. If the pressure, if it is high, the anti-glaucoma medications that either from our side or from whatever they are using from other side, let them use it. And along with that glaucoma management and treatment. And many of the times, what we used to do, the tharas, like takar tharas or kashaya tharas, the content of that thara, probably many of the things it is methia drugs. Amalaki, it is a methia drug. Yashtimadu, methia drug. Jyotishmati, methia drug. So many of the things, according to the situation, we will be changing and utilizing. And increase the stress level also may increase IOP and thereby leads to nerve fiber layer thinning. Here also the nerve fiber layer thinning happening, changes happening. There the ultimate attention, the pressure control as well as in that RNFL changes need to give some rasayana aushadas also. And then the methya rasayanas, the other rasayanas, ashugandha rasayanam, amalagi rasayanam, Chapanaplasma rasayanam, Kritam. Adimanda has a well-known association with the Manasiga Bhavas. Adimanda Chilsa includes Amapajanam, Snehanam, Shodhanam, etc. treatment. Here the treatments like Segam, Ashodhanam, Pindi, Vidalaga. I told you earlier, when sometimes Tarpanam may be doing, may not be doing, and different Anjanas and Pathyapatyas. In Pathyapatyas also, and Avatyaharas to be avoided, and mainly the Kridapanam and Triphala Prayogam, Metirasayanam, very much useful in this context. And the Takrathara, Amalagi with Medhya drugs, Talapudichil, very effective, and normally Amala, cooked Amala, and added with some Medhya Ushadis that can be given, and Panchakarma procedures, etc., can be given in the management. In ARMD also, the cortisol level, as I told you earlier, its variation may leads to the macular regeneration. Genetic factor, it is one among the main reason. And edema induced. There are wet macular degeneration, dry macular degeneration. So treatment accordingly. If there is some fluid, if there is some stress involvement, if it is there, and to control the stress level, some kind of attention is required with the medicine in the medicine form, along with either if it is a wet kind of changes, some kind of samana aushadas can be given along with the medhya rasayanas. In old age period, when the stress level is at peak due to various reasons. And in those patients, we can do the thara with tiladailam or other processed oils or processed almond oil. Anything can be given. Not anything, but depends the condition, we can plan the treatment. And worries about aging in place, relying on others, and performing daily tasks independently are common cause for the stress in seniors. And many of the genetic disorders, as I told you earlier, the consanguinity sometimes may be the main reason for some of the eye diseases, labors, congenital amaurosis, RP rogas, RP, macular degeneration. And all these conditions, its treatment along with the medhya aushadhis can be given. RP might lead to various mental disorders, especially obsessive compulsive disorders. Patients with RP may develop a kind of psychological disorder in period of their life. Ignoring their mental disorder will deteriorate the RP course and finally result in their rejection by the society. Psychological support which can be provided by either professionals or supportive patients and family is often crucial in the course of RP. As everyone knows, this is condition, it is not curable. How to prevent it, how to control it, how to progress from this level to the next level. The probable management we can give, and also they need a support from the parents and the other social workers, and they are eligible for many kind of job opportunities. How in India only the people with RP, they are living inside home, not going outside and always sleeping and not doing anything. But in abroad, if you go and they are happy and they are working their own and they are moving independently, and the proper attention, the proper guidelines they are getting, what to do and how to live with this. So kind of attention, kind of teaching, kind of counseling is required from a good um, psychologist. So psychologists are very well, and they can help a lot to such kind of peoples. These are all bija, I to say bija dushti janya rogas, chachushya, chikitsa, ahara, and vihara along with major sign already suggested. Diabetic retinopathy can result from mental stress and if uncontrolled stress that lead to increase of the sugar level. It is a psychosomatic condition. So mentally stable, the chances to get the diabetes is very less. But hereditary, it is a major factor. It is hereditary. The treatment is required, not just to treatment, the medications, the proper how to live, what all the things to do as an exercises, what all the diet habit to follow. Because earlier itself, they follow the healthy diet, that which should not harm the system. It is good to maintain their sugar level as well as and secondary complications of diabetes, retinopathy or nephropathy or neuropathy or increased belly size, obesity, and senselessness. Many conditions associated with the diabetes. And everything it is not possible to say at a stretch. So there are different stages. Medhya sayanas and amalagir prayogas are good in this aspect of diabetic retinopathy. Treatments in a diabetic retinopathy, bleeding. If there is some bleeding, Even many times I presented my views. The Raktapitta Chikitsa can be given. Jara Chikitsa, it is very much adaptable here in this context of diabetic retinopathy. And usages of Shankupushpi Prayogam, Jyotishmati, and Dronapushpi Prayogam are good in the condition of diabetes retinopathy. For the better perception of vision, and Manaprasadana Aushadhis also need to fulfill the link between Atma to Mana to Indriya, and Indriya to Artha. So Meterasayana is given here in this context. Manasika management of eye disorders considering Manasika Bhavas. As you all know, the treatment it is of Trividha Chikitsa, Deva Vyabhasraya, Yukti Vyabhasraya, Sattvavarya. I'm not going in detail. And Deva Vyabhasraya Chikitsa means the treatment based on believing or divine power or divine remedies. And this pattern is different. This modality is different in different places. And somewhere some worship in temple, somewhere some mantra japa, somewhere wearing monies, doing some homas, and some rigid acharas and confessions, upavasa, and many things. That the region wise and the community wise, that differs, that as per their will. Because if that kind of a puja or going to the mandir, if they are giving relief from their mental stress, let them do it. And the other thing, it is Yukti Vyabhasraya Chikitsa. This is the treatment going on. Yukti means intelligence or skill. Yukti Vyabhasraya Chikitsa is the treatment in which the medicines, lifestyle, and the diet are skillfully planned and administered. So here, the treatment, the deciding doctor and the nurses, they are giving the treatment. And as per Ayurveda, treatments like Panchakarmas are the treatment, Samana Ushadas, Sodana Ushadas, Rasayana Ushadas, Vajigarana Ushadas, Meti Rasayanas, Chakshushi Rasayanas, and many things, and other therapies, psychotherapies, many things. And Kritapana, it is a good thing to improve our mental ability, mental status. Intake of ghee nourishes the nerves and strengthens the eyes. It is that enhances the smriti, medha, agni, and examples of krita which use in manasya bhavas and even in netra rogas, dhammi krita, kalyana krita, panchagriya krita, etc. Sattva avajeti means improving the sattva of a patient. And Ashtanga yogas, the 8 limbs of yoga, yama niyama asana, pranayama, pratyahara, dharana, dhyana, samadhi. And yamas are ahimsa, satyamasteyam, brahmacharyam, aparigraham. Yamas like daya, arjava, shama, dhrudi, shaucha, hidahara. Niyamas like shaucha, purity of the mind, cleanliness of body, santosha, mental ease and contentment, and tapa, social service, swadhyaya, inspirational reading, and Ishvara Pranidhana, to meditate on the cosmic consciousness. Anything Sauja, that treat the Mano Saujam, Santosham, happiness, that to maintain, and how to be happy, that one to explain to the patients. And the cleanliness. If the patient, if it is not so cleanly, the eyes, if it is not clean, the head, if it is not clean, the physique, if it is not clean. So some cleanliness procedures to be given, and some meditative procedures to teach the patient. Asanas, like asanas, it is a good thing that to improve the circulation. Asanas and pranayamas, anilom bilom pranayama. Many of the conditions, many of the degenerative conditions, genetic conditions, if your brain gets some good oxygenation through the pranayama, and the relaxing in on a comfortable position and sitting doing after doing the yogas, asanas. If someone is doing pranayama, it is very good to improve our mind, to get a good mental stability, to good oxygenation to the retina. That gives some good vision. And the therapies before you can do the therapies like the palming exercise.
Sir, please unmute your mic. You are muted. So you can click on escape button, then the windows will come here, MS Teams. Yeah. Now okay, sir. Please continue. Sir.
It works on pranayama, it works on controlling the vital energy, improves the manomaya koshas. And the pratyahara means the withdrawal of mind from the attachment of external objects. Dharana means concentration of mind at a specific point and that nourishes vijnanamaya kosha. And jhana, it helps to perfect the most suitable layer of the mind and leads to persons to a final step of Ashtanga Yoga Samadhi. Counseling support, counseling and support are essential components of ophthalmic care that aim to help patients cope up with the vision loss or treatments to improve their mental health and wellness. It can be provided by various professionals such as optometrists, psychologists, psychiatrists, social workers, nurses, and counselors. Only one thing, make sure about the uh, recent advancement in the ophthalmology supports. So then only those who can teach to the patient what to do and what are all the good opportunities available with them. Methods of counseling and support. Counseling and support can improve various methods such as psycho education, cognitive behavioral therapy, and interpersonal therapy, and mindfulness based therapy, and motivational interviewing or group therapy. For example, psychoeducation is a method that involves providing information and education to patients about their eye condition, treatment options, prognosis, and coping strategies. Another example is cognitive behavioral therapy, CBT, which is a method that involves identifying and challenging negative and beliefs and replacing them with the positive ones. Counseling support and support benefit. Counseling and support can have various benefits for patients with eye problems, such as reducing anxiety and depression, enhancing self-efficacy and resilience, improving adherence to treatments plans, increasing social support and participation, and promoting quality life. For example, study by Ranver et al. In 14 found that cognitive behavior therapy reduced depressive symptoms and improved vision function in patients with macular degeneration. Another study, because if we give some good positive things feedback to the patient, positive energy to the patients with your valuable support. If their mind is calm and relaxed, the chances of further degeneration not happening. Another study by Holloway et al. In 2015 found that a group therapy increased social support and participation in patients with a visual impairment. And in concluding this session with this message, understanding the mental state of the patient is a crucial aspect of diagnosing and treating netra rogas. It is important to take into account the emotional and psychological well-being of individuals, as it can greatly affect their physical health. By acknowledging these factors, healthcare professionals can provide a more comprehensive and empathetic approach to the treatment. Therefore, it is essential to prioritize the mental health of patients alongside their physical health when addressing eye diseases. Thank you.
Thank you, sir, for such a wonderful and informative session. Now session is open for question answers round. So anybody who have any kind of query or doubt or questions, then you can put your questions on chat box. Any questions?
Hello,
Hello.
may I ask directly, sir?
Yes, yes.
Thank you. Sir, the stress or the manasika, the mental pressure or strain related to eye problems.
Hmm.
So I want to know the here mind or mental stress is related to manas or the brain.
Mental stress, it is due to manas, and that is due to manodosha Vaikalyam. That means imbalancement in the manodoshas that leads to mental stress.
Yeah.
Just imagine the stressed mind is the house of evils. So that evilness in ourselves that leads to not just eye disorders, many conditions. If a happiest man, the relaxed man, not getting much issues. So it is factor the imbalancement in the rajoguna and the tamoguna. Even many times the food, the tamoguna pradhana food taking, that is sometimes leads to issues.
Yes, sir, that I do understand. The mental strain or the manasika, the pressure that leads to not only eye disorders but all disorders. What I wish to know is, see, the to relieve that the mental pressure. Then you said the even the ideas produced out of the mental strain can be cured with dhara and medya rasayanas.
It can be controlled with the dhara methi rasayanas. Dharas like it is not just a dhara. Even if it is required some counseling kind of support, that also psychotherapy also can be given.
Yeah. That yeah. My point is that, see, because in my experience, a case of cerebral palsy where the everything is recovered except vision. After as you said, after giving the Medya Rasayanas, the gist of the treatment over a period of 1.5 years, the child recovered complete vision. It is not related to the stress. The lesion was in the brain. Lesion was in the brain in calcarine area. Calcarine area underwent the atrophy.
Not
And
always
after
related.
giving this Medya Rasayanas, my own formula, then it improved. 100% vision is improved.
Very good, very good, sir.
So that is what I want to know. See, whether according to Ayurveda, can we relate mind or manas to the brain or not? Because here you said the same in psychological stress or mental stress.
Mind linking to brain, that direct correlation as such, it is not possible, sir. And mind, it is the mind, manas. So the adis or vyadis which is happening to the minds leads to the other issues. That as you said a case, it improved a lot, and that is a good news. And only with Medya Rasayanas or Manaprasadana Aushadas, sometimes it may not be happening. So there are, you already given some Rasayana therapies also. Probably that helped.
Okay, thank you, sir.
So we have one more question asked in chat box by Miss Priyanka Danwar, that what are the Kuzamfu Kalpana used for eye disorders?
What Kalpanas?
Kuzampu. Miss Priyanka, are you in the session?
Priyanka,
Kurambu.
Hmm?
Kurambu.
Hello.
Kudamba Kalpanas used for eye disorders. Your question it is Kudambu Kalpanas. Hello?
Yes, sir.
Kudambu Kalpanas in many of the schizophrenia conditions need to give some Kudambu, that is Krishna Anjanas can be given. That to relieving from the bondage, the dosha bondage. So some Krishna Anjanas can be given to the eyes, not in the case of eye disorders, but in the case of manovigaras. Karpuradi Rasakriyanjana can be given in a vitiated mind, in an aggressive mind, aggressive thoughts. To make the patient little calm, kind of Krishna Anjanas can be given.
So we have one more question in the chat box asked by Dr. Robin, that I think he is suffering from a headache since childhood. So any yoga or medicine to resolve the headache issues?
That it is better to consult a nearby with all the darshana, sparshana, prashna parishas, and that will be better, no, instead of giving some medicines. Anything more? And Dr. Robin, your headache, due to what reason? Is it due to eye pressure, or is it due to dryness? Is it due to vascular reasons? And is it sometimes due to cervical issues? Many reasons are there now, so it is very difficult to give such a medicine immediately. Any more questions? Yeah, mute on. Chanchal, you are muted.
Okay. We are just winding up the session with a thank you note to all the participants and to our guest, Dr. Narayan Nambudiyar. Thank you, sir, for giving your time to us. And
Thank you.
topic and speaker of next webinar will be informed to you all soon. Thank you for everything and have a good day and good time.
Thank you. Thank you.
Thank you, sir.
ഇടയ്ക്ക് 140 വരും.